Welcome to Caregiver Chats. Today, I'll dive deep into the topic of driving safety for older adults and how caregivers can approach the conversation. So stay tuned and we'll get into it. I'm your host, Dr. Lakelyn. I'm a gerontologist and caregiving advocate for Home Instead, an honor company. I know how busy caregivers are, and I'm so grateful that you're taking the time to listen. Today's topic is one I regularly get questions about, and it can be one of the most challenging topics to address. It is the topic of driving. The driving conversation is one that often involves a lot of emotion. For many, driving equates to independence and the freedom to go where you want when you want. Think back to when you first got your driver's license. For me, it meant freedom to go when I wanted, where I wanted, to hang out with my friends whenever I wanted. It allowed me autonomy and independence, or at least I thought so. But in the U.S., we especially equate driving with independence. And in many communities, driving is our main mode of transportation. So again, driving equals independence. As a person ages and we experience physical and cognitive changes, it may impact our driving. And that's why it's important to openly communicate about driving abilities and safety early on, rather than waiting for a crisis to occur, such as a crash or a close call. Families often find themselves challenged with how to talk about driving and the best approach to taking away the keys. And I want to be clear from the beginning of today's episode. I'm a gerontologist, so I'm always looking at it from the older adult's point of view. So I think it's really important that we don't jump right to let's take away the keys as our first option. Instead, if possible, let's try to optimize driving safety first and keep the older adult driving as long as we can before, again, we jump to that conclusion of, okay, it's time to take away the keys. However, if a person does need to hang up the keys, it's really important that the family develops a plan to help them transition out of driving and find alternate transportation options so that they can still remain engaged with family, friends, and their community. Let's start by talking about older drivers and how age-related changes can impact their driving abilities. As our population ages, the number of older adults driving is also growing. We see approximately 84% of Americans age 65 and older, they continue to drive. And while many continue to drive safely, we also know that a crash involving an older adult is 1.5 times more likely to result in a serious injury. But also, on the flip side, some good news is that older drivers, they tend to be more likely to wear their seatbelts and less likely to speed or engage in other risky driving behaviors compared to younger generations. However, we need to remember that driving performance is not related to a person's age. It is their fitness to drive or their ability to drive that matters. I've seen people who are 95 years old that are still driving very safely and successfully. And I've also seen people in their 60s who can no longer drive due to health conditions. So again, we cannot take away the keys at a certain age. We need to look at the person's ability to drive and assess it from a safety perspective. As we age, we're more likely to encounter age-related changes. And when these changes occur or a new diagnosis is given, we sometimes see this impact the person's driving abilities. So I want to start by talking about some of the obvious conditions of growing older that might impact a person's ability to drive. First is visual and hearing impairments. Again, one that seems kind of obvious, but there's various age-related eye conditions that could impact a person's field of vision and their visual acuity, which is the amount of detail that a person can see. These conditions could include cataracts, glaucoma, and macular degeneration. These sorts of impairments can impact a person's ability to read a roadway sign, to see other vehicles or pedestrians, and so forth. Similarly, if an older adult also is experiencing or alternately experiences changes in their hearing, this could also impact their ability to drive because they may not be able to hear emergency vehicles or other audible cues that are really important to driving. Next is functional impairments. There is a variety of functional impairments that could impact driving as we get older. And this could include sensory things, like a tingling or numbness or loss of ability to feel, maybe in your hands or your feet. It might also be a functional impairment that weakens our ability to grasp objects or impacts our ability to release objects. And you can imagine how this would impact a person's ability to control a vehicle. Other functional conditions could involve that strength and flexibility I just mentioned. This could impact a person's ability to move the steering wheel or to change lanes effectively, to maintain a consistent speed or, turn your body to see those blind spots. And when we talk about functional impairment, it could also be the person's ability, to utilize the gas and brake pedals with their feet or fully turn their head. I have had days when, I've slept wrong on my neck and there's a kink and I feel like I have to turn my whole entire body to look to the lane next to me before I switch lanes. And it takes a significant amount of effort and vigilance. So imagine that was the case, around the clock, 24/7. That would really impact your ability to drive. So we need to be mindful of those functional limitations. Some other physical limitations could result from conditions such as arthritis, a stroke, MS, Parkinson's disease, or if a person has an amputated limb. In these cases, there may be assistive devices that can help people with these limitations continue to drive safely. Another important factor to consider is cognitive conditions and dementia. A cognitive condition or dementia could impact a person's attention, judgment, problem solving, reaction time, planning, sequencing, impulsivity. I could probably go on and on. There's a lot of things that this could impact. Therefore, a person's ability to drive may be compromised if they have one of these conditions. They might not be able to concentrate or respond appropriately, react in a timely manner. So it's really important to evaluate where the person is in the disease progression. Especially earlier on in diagnosis, in the early stages of dementia, a person still might be able to drive safely. However, as the disease progresses and they experience, changes in their cognition, we need to be evaluating their ability to drive. And they may eventually, most likely, will need to transition away from driving at some point in the disease process. The next two are a few chronic conditions that might not seem as obvious, but they are really important to consider in relation to driving. The first chronic condition that we see commonly in older adults is diabetes. And some of these diabetic symptoms could be problematic for driving. One result of diabetes for some individuals is neuropathy, which can cause the sensation in a person's hands or feet to be impacted. And so it can sometimes feel like a numbness or tingling. And so this could impact a person's ability to grasp the steering wheel and to use the pedals. Diabetes can also have long-term impacts on a person's vision. And those that have issues regulating their insulin levels or fail to properly manage their diabetes could be at risk of hypoglycemic episodes that could be really dangerous if it happens while they're driving. So something to keep an eye on. The other chronic condition that's common among older adults is cardiovascular disease. And some symptoms of this is chronic fatigue, shortness of breath, or dizziness. So you can imagine that this could also impact a person's driving. So it's really important to be in tune with these types of symptoms. And with all of these changes and conditions that I just mentioned, it's important for you as the caregiver and for your individual aging loved one to discuss these conditions with the healthcare provider and also talk about, how this could potentially impact their driving now and in the future. So let's now talk about some potential signs that a family caregiver can look for when an older adult may be an unsafe driver. Caregivers, if you have concerns about your loved one's driving, I encourage you to go for a ride with them. Do a ride along. This can help you assess how they drive. But also bear in mind that with you in the car, they might be trying to put their best foot forward. So if you are doing a ride along, some things to pay attention to are they using their turn signals properly? Are they having difficulty making turns, staying in the lane, judging the space in between cars. Are they responding properly to the other vehicles, motorcyclists, bicyclists, pedestrians, and any other road hazards? Are they stopping in traffic inappropriately or not following traffic rules? And are they driving at inappropriate speeds? Are they going too fast? Or are they going too slow? Also, if the individual has a history of traffic violations, crashes, warnings, or unexplained dents or scratches on their car, these are other signs that the individual may have impaired driving skills. You might also want to gather feedback from others that regularly see your loved one drive, such as neighbors, maybe there's other family members, and ask if they've noticed any changes or issues. So if you are observing your loved one's driving, you're noticing these changes, it's really important to bring up your concerns with your loved one. But it can be really hard to do so. So let's chat about some conversation starters. No matter how you start the conversation or how it takes place, you want to be sure to avoid sounding accusatory and allow for a two-way discussion. A lot of times it's helpful also to reassure your loved one that you're not looking to jump to any conclusions, but you just want to discuss some concerns and understand how they're feeling about their own driving abilities. You also want to communicate that the focus of the conversation is not to take away their ability to drive, but you're committed to exploring all reasonable options for keeping them mobile and safe. And this can help, to kind of lower their defenses, because sometimes people can get very defensive in these conversations, and it might help make them more open to talking about it. But notice how I said, reasonable options for helping them continue to be mobile and safe, because for some, there might not be any more reasonable options to keep them driving, and we might have to start looking for alternate modes of transportation. But again, if that's the case, if we need to hang up the keys, stop driving, we need to have a plan in place on how to keep them mobile and getting where they need to go. And we'll talk more about that in just a bit. But I want to share some questions you can ask to get the conversation started about driving. So these include questions like, Mom, how are you feeling about your current driving abilities? And you could follow that up with, have you noticed any changes? You could ask, hey, Dad, do you ever feel uncomfortable, stressed, anxious when you're driving? If so, let's talk more about those situations. You could ask Aunt Sally, have you ever experienced a significant change in your health or started taking a new medication? Have you talked to your doctor about how that will impact your driving? Sometimes medications, especially if they're new to the medication routine, they could have some additional side effects that may impact how a person can drive. Another question is, have you experienced a crash recently, or have you narrowly avoided a crash, or sometimes we call those a near miss? Have you had a near miss recently? And then talk about that. You could ask, are you making mistakes while you're driving? A final question to consider is, have you had some incidences of forgetfulness or getting lost while driving? And you can talk with them about that. Some families find it helpful to bring in a professional to help with these kinds of conversations. You may want to get the doctor involved or utilize a clinical or geriatric expert to help support with this whole transition process. There are actually people called driver rehabilitation specialists out there, and they can help with all of this. I'm going to tell you more about those types of professionals in just a bit. Another way to approach the conversation is to utilize self-assessment tools and have your loved one evaluate their own driving. These tools can help the older adult identify where their own concerns are about driving and may help them see things from a different perspective. One tool that can be really helpful comes from the National Highway Traffic Safety Administration, and I'm going to share a link in the show notes. But if you just Google National Highway Traffic Safety Administration self-assessment, it's going to come up in your search. But what is great about this assessment is that it helps the older adult assess 3 different categories. 1 is reaction time, 2 is physical fitness, and 3 is vision. So one example of the questions related to reaction time is, Do you often feel overwhelmed by all of the signs, signals, road markings, pedestrians, and vehicles that you must pay attention to at intersections? So it has them, again, self-evaluate questions like that. An example of one of the physical fitness questions on that assessment is, do you have trouble moving your foot from the gas to the brake pedal? Or do you have trouble turning the steering wheel? Again, having them self-assess. One of the vision questions is, do you have trouble seeing the lane lines or other pavement markings? Do you have trouble seeing curbs, medians, other vehicles, pedestrians, especially at dawn, dusk, or at night? So again, these self-assessment tools can be really great to get the person thinking about their own driving, and then you can use it. You can review it together as a great conversation starter. And as you're discussing, you can talk about the options to optimize the person's driving abilities. You may determine that you need to put some additional safety measures in place, such as agreeing that they'll no longer drive at night or in inclement weather like snow or rain. Or maybe they will avoid driving during rush hour. And then you could also make modifications to the vehicle itself. There is a great program called Car Fit, and they host events across the country where trained experts will show people how they can enhance the comfort, safety, and fit within their own vehicle. Again, it's called Car Fit. I'll link to it in the show notes, but you can also visit their website, car-fit.org. They also offer online and on-demand workshops, some of which highlight some really simple things like adjusting your mirrors and your safety belts. Other videos that they have go over the safety features in cars that are available today. And many cars have a lot of built-in safety features. I recently got a new car. I was driving a 2016 Honda, and it basically just had a backup camera, and it didn't even beep at me if I got too close. And unfortunately, one time I got a little too close, but that's a topic for another day. But as I was test driving for my new car, I was blown away by all of the safety features that are out there. It's almost overwhelming. Some of these features could be helpful for an older adult. And so family members could consider maybe that the older adult needs to upgrade their car. Maybe they've had the same car for years and a newer model could, if it's an affordable option for them, be a safer way to continue driving. However, it's also important to consider that with all of these new bells and whistles, these great safety features, it could take your loved one a little time to adjust. I think I'm still adjusting to my new car. But Car Fit is just one of the many resources available out there that I'm excited to share with you today. And I'm going to share even more resources. But first, we'll pause for a quick word from our sponsor. This podcast is brought to you by Home Instead, an honor company. If you find yourself needing extra support as a family caregiver or time away from your caregiving responsibilities, Home Instead can help. Our home care services are delivered by compassionate care professionals and range from personal care, meal preparation, and medication management to Alzheimer's care and hospice support. Visit homeinstead.com to learn more and to find a location near you. There are some really great resources out there for older adults as they continue to drive and assess their ongoing ability to drive. I've linked to a lot of them in the show notes, and I'm about to discuss many of those now. I've mentioned the National Highway Traffic Safety Administration already. They have a great older driver resource page that has really helpful information and assessments like the one I referenced earlier. In addition to that group, there's another organization called the Clearinghouse for Older Road User Safety. That's a bit of a mouthful. Clearinghouse for Older Road User Safety, and they go by CHORUS for short. Their website is roadsafeseniors.org, and I really like this site because it has so many great tools for the older adults, but also for family caregivers. It has a state-by-state listing of all the driving resources available in each state, and also has some budgeting tools for driving or for helping to lead a discussion about transitioning out of driving. Another great resource to look into is an occupational therapist or a driving rehabilitation specialist. I promised earlier I'd follow up on that one. But first, the American Occupational Therapy Association has some great resources on their website regarding driving and community mobility. And then there is an Association for Driving Rehabilitation Specialists, and their website has a place where you can go on there and search to find one near you. But these specialists help assess a person's driving abilities. Some may have the older adult come into their clinic for a variety of tests, while others may do a ride-along with the older adult. But after the assessment, they can make recommendations for modifications, and they may also recommend that the person's no longer fit to drive. Another helpful resource to look into is the National Aging and Disability Transportation Center. Their website can help you locate local transportation programs in your area, which is a great resource for those that have to stop driving. And I want to end today's episode by talking more about that scenario. Again, this should be our last resort, but it is a reality for so many, and it can be really hard to navigate. It is so crucial to work towards a plan when a person has to stop driving or give up the keys. It's important for so many reasons, but one specifically being that when an older person stops driving, they're at an increased risk of isolation. We need to make a concerted effort to ensure that they can continue to stay socially engaged and get to where they need to go or want to go. This is so important because we know there are many effects of isolation that can be really devastating to an older adult. So when you talk with your aging loved one about giving up the keys, again, it's important to involve them in the discussion and also involve them in the plan. Ask them, what are the activities that you do outside the home that are most important to you? And do your best, as part of that plan to prioritize those activities and make sure that you find a way to help them get to as many of those activities as possible. Also ask them, how are you feeling about giving up driving? Acknowledge their feelings. I mentioned at the very start of the episode, this is an emotional topic. So you want to let your loved one, be heard, be understood. And really, your loved one best and the best way to approach the conversation. But one thing that could be helpful, again, depending on the person, is you could review with them the economic impact of cost savings and benefits of not owning a vehicle. That could be one way that you could bring up the conversation. But be sure to research and understand all the transportation options available in your area so that you're ready to discuss them with your loved one as part of this plan. So if you're thinking about, okay, we have to give up the keys, we're going to create this plan, what are all the options I can kind of present? Who all can I get involved in helping to make sure my loved one can continue to go where they want to go? Well, I have some ideas on where you can go to look for those types of transportation support. So first, you could enlist the help of family, friends, or community volunteers. I think I've maybe mentioned this on the podcast already, but in my family, we have a family group chat called Grandma's Drivers. And so we will, all kind of chip in when grandma needs help. The request goes out via the text message string, and we kind of jump in with our availability. So that could be one way that you could help make sure that they get to go where they need to go. You could also look into rideshare apps like Uber, Lyft, or there's one specifically for older adults called Go Grandparent. You could utilize home care services like the ones we have at Home Instead for transportation and also the added benefit of social engagement. We can help them get to appointments, social outings, wherever they need to go. We can make sure that they get there. You could also contact your local area agency on aging to see if they have senior ride programs. They might also have paratransport services, and also some of them have even reduced fare programs for the local bus system or for taxis. So make sure to reach out to your local area agency on aging. You could also look into services that make house calls. For example, a hairstylist, instead of going out to get your hair done on a weekly or monthly basis, maybe see if we can find one that can come to the home. Maybe the same could be true for foot care or for other types of healthcare services. Again, that way they can still get those appointments taken care of, but they don't have to leave the home. You could also look into delivery options for things like groceries or the pharmacy. That could eliminate one more place that your loved one needs to go throughout the week. You could also coordinate a carpool with family, friends, or whoever might also be attending a regular activity or gathering. For example, if they go to a senior center, maybe one of the other participants that still drives can pick them up along the way. So I hope that these tips are helpful, but I also realize you could be met with resistance in this conversation. And if that's the case, I want to suggest a few things you can try. First, you could try the conversation again at a later date with maybe a slightly different approach, or maybe an alternate family member could attempt to bring up the conversation to see if maybe they're more receptive to that person. Some families have one individual that the older adult really responds well to, so it could be good to have that person involved. You could also ask that your loved one's healthcare provider, their doctor, brings up driving at the next visit. Sometimes when they hear it from a third party, the information is better received. So the doctor may be a great person to lean on for a conversation about driving. They might also be able to make a referral to an occupational therapist or driver rehabilitation specialist. In more extreme cases, when you've tried to discuss with your loved one and they refuse, and you know that they're in a danger to themselves or to others, you may be able to report them to your local DMV or call to see if they can retest your loved one's driving abilities. Each state and even individual cities or municipalities have different laws on driver license renewal. And so you want to look into what those laws are for your state. And on that website I mentioned earlier, roadsafesenior.org, you can find that state-by-state listing and more information. Ultimately, as I mentioned earlier, you know your loved one best, so you'll know the best approach that will work for them. But don't be discouraged at the first attempt to discuss driving if it fails. It may take several conversations. If they're not in immediate danger, it could also be a gradual process of driving less frequently and starting to integrate transportation alternatives before they fully give up the keys. I mentioned my grandma in our family group text. She's an example of how we've started kind of transitioning. She stopped driving at night, and our family always offers to give her a ride to any family get-togethers. The only place she still drives herself really is to Bridge Club and her weekly hair appointment, both of which we make sure that are scheduled at times that avoid rush hour. And at some point, she will likely need to give up the keys altogether. But for now, between that solution and our family group text, Grandma's Drivers, we have found a solution that works for her. So again, it may be a gradual transition, and it's one that you'll probably have to discuss at several points over time. I want to wrap up today's episode with some final thoughts on this topic. As a reminder, you want to approach the discussion about driving from a place of empathy and inclusion. Remember that for so many, driving is an important part of a person's independence. Including your aging loved one will hopefully help them feel more in control and more bought into the plan or the solution. And if you're met with resistance, be sure to give yourself some grace. This is a really, really tough topic and one that many caregivers struggle with, so know you're not alone. I hope that the information and resources I've shared today have been helpful. And if you have any tips on how you've navigated this difficult topic, please email me at caregiverchats@homeinsteadinc.com. That's caregiverchats@homeinsteadinc.com. I also invite you to follow us on Facebook and YouTube at Home Instead Inc. That's Home Instead INC. There you'll find previews of upcoming episodes, caregiving tips, and more. You can find all the links in today's show notes. Thank you for listening, and please remember to take good care of yourself while you care for others. Caregiver Chats is brought to you by Home Instead. If you're looking for in-home care to support you on your caregiving journey, please visit homeinstead.com/caregiverchats to learn more.